Welcome to Quantum Photonics. In the digital age, social media is more than just a platform for connection. It's a powerful force that shapes our behaviors and decisions, including those related to health. With over 4.76 billion users worldwide as of January 2023, social media's reach is vast and its influence profound. The paper, Understanding the Complex Links Between Social Media and Health Behavior, explores how these platforms impact our health choices, providing a nuanced look at the benefits and challenges they present. Today, over 90% of people connected to the internet are active on social media, and this widespread adoption has transformed the way we interact with information, moving from passive consumption to traditional media to active engagement with targeted, personalized content. Social media platforms rapidly disseminate information to large audiences who, in turn, shape and engage with this content in real time. This shift has positioned social media as a primary news source for many, despite ongoing concerns about misinformation and the need to distinguish between reliable and untrustworthy sources. Our guest speaker here, Professor Fabiana Zollo, is an associate professor of computer science at Foscari University of Venice, Italy, where she leads the Laboratory of Data Science for Society. In 2019, she has been serving as an expert to the European Food Safety Authority, or EFSA, and in 2020, she joined the working group established by the Italian Presidency of Council to study the phenomenon of disinformation of COVID-19. So, without further ado, I would like to bring Professor Fabiana Zollo to the audience here in Quantum Photonics. Fabiana, welcome to Quantum Photonics.
Thank you, Cecile. Thank you. I'm really glad to be here today, and nice to meet all of you. And thanks for being here and listening to this quick talk. But I hope that we will also have a good discussion very soon. So, do you want me to start, Cecile? I guess so. Okay.
Yes, I
Um,
could not open my
okay.
mic earlier, so yeah, please, we
It's
are
fine. Thank you.
eager to hear your presentation.
Thank you. The article that you can see here, it's linked here in this event. It's an article that that appeared very recently on the British Medical Journal, and this is an analysis article where basically with my colleagues, we wanted to put together what we know so far on the influence of social media on behavior and in particular on health behavior. Of course, whenever, as Cecile introduced before, we all know and we are all here today on another social media platform. So we know that social media have become very central in our lives, not only for meeting friends or engaging with other people, but also for engaging with content and with information. So of course, this is something that raises possible concerns on how this content and this information that we can engage with online can also influence our choices in the offline world. And this is very often also an assumption that is kind of given for granted, like that we kind of assume that there is some sort of effect, okay, of the kind of information that we interact with online and what then we do with our life. But things are a bit more complicated than that when we want to study this kind of relationship, and especially when we want to study this relationship and the causal relationship between these two, so between social media and behavior. I mean, generally speaking, proof a causal relationship is of course more complicated than just showing some sort of correlation that we can find among two different phenomena, for example. But in this particular case, it's also very challenging to one side what it means to measure behavior, and on the other side what it means to measure social media, how information on social media spreads, and how we interact with misinformation in general. Usually whenever I give talks topics, I always tend to highlight some characteristics of social media that are really, really important to understand, not only how information spreads, but also how we behave as users on social media. And of course, we know, okay, social media, and are part of the internet, and we know that with the advent of the internet, but especially with social media, the possibility of connecting with people all around the world, increased a lot, enormously. And we have nowadays the possibility to communicate with people all around the world, and in every time of our day, basically with no barriers. There is no temporal and no barriers. So this of course facilitated communications globally, and on the other side, this is a structure that of course facilitates communications and information spreading, but also this is also true when the quality of this information is not as high as we would like. And so it's also true when we talk about misinformation. On the other side, the fact that we are basically hyper connected, and so we can access these platforms to communicate to one another, but also to produce content, increased on the amount of information that is at our disposal, but also the amount of information that we have to deal with every time that we use our smartphones, for example. And here, this is an important characteristic. So the fact that we have lots of information, this information can also spread, very quickly, and is also spreading through channels that are not necessarily just channels that we use for getting informed, but are also channels like social media platforms where we can also engage, and that we can use just for entertainment. And so basically, but the problem is that on the other side, we are still the same, human beings, and our attention is limited. So we cannot really deal, with all this amount of information. So in this direction, what happens is that there is a first filter, that is the filter that we apply. And so it's usually, the fact that we tend to prefer content that, is already, for example, aligned to our worldviews, to our opinions, to our beliefs. And so we tend to choose and interpret content, for example, according to confirmation bias. So this human tendency, okay, to select, interpret content in a way that is aligned with our set of beliefs. On the other side, of course, we also know that on social media we can also have, algorithms that are there to facilitate this filtering. And these algorithms, in some cases, can also, in some sense, reinforce our, the activity of confirmation bias that is over there. And so this idea that, the algorithm is always pushing, and showing content that aligns with our history, with our preferences, past preferences. And what we have been observing over the years, is that very often when we analyze the data coming from social media platforms, what we find is that usually users tend to confine their attention to some, groups of, for example, information sources of some group of users that are aligned and to their worldviews. And this is what we call the echo chambers. And maybe some of you already have heard this term. Uh, what I want to stress here is that echo chambers are not just something that is something that we can just observe online. If you think about your life or your circle of friends or whatever, so of course we tend to choose people and information sources according to our preferences. Of course, this on social media can be important and can be useful to be aware of, because on one side, because the other one of the side effects is that we tend to ignore what's happening outside of these echo chambers. And so, for example, what's happening, what are the worldviews that are different than ours, and sometimes we can also just be wrong, and it can also be useful to interact with information dissenting from our own opinions. So echo chambers is something that we have been measuring and observing online, and of course they are also really important when we, for example, want to understand not only what can be their effect on the users, for example, in terms of polarization, or the kind of information they can access to, but it can also be interesting, and it's necessary to understand what's happening and what are the dynamics online, for example, if we want to devise communication strategies. And this is also something that, of course, in the case, for example, of public health responses, is really important. So this is usually, the kind of, in summary, I would say this is the kind of, what we have been observing so far. Then of course, so far I've been talking about social media, like, this one big, I'm using the term as a big umbrella term. Of course, we know that social media platforms are very different than one another. And when we say that they are different, it means that they are not only different in terms of the functionalities that they offer, or the kind of content that you can find over there, but also in terms of their populations. So who are the people, on that particular platform? And this is not only something that it's, so population may differ not only across social media platforms, but also across, for example, countries or continents. Why I am telling you this now? Because this is, for example, again, one of the other challenges, of one of the many challenges, I would say, that we have whenever we want to understand what's happening and what's the relationship between, what you are observing online and what's happening offline. The real challenge is that there are very few data, and sometimes it's really hard to connect the activity of users online to their activity offline. This is for a variety of reasons, and some of these, of course, encompass privacy and ethical concerns. But basically, the fact is that what I am observing and finding, and also sometimes measuring, thanks to data availability on social media platforms, does not necessarily reflect, the entire population, for example, of that particular geographical area, that particular country, or so on. And so this is this is another obstacle. So first of all, what I'm observing, is some partial information and so I'm not have very often we do not have any demographics or any data that we can use, to make this connection. And then of course the big problem of connecting, the same users online and offline. So big challenge in basically in revealing, let's say, this link is data access and data availability. Then we also have the challenges that are related to how we can measure, this, for example, behavior, or how we can measure misinformation. So when we talk about misinformation, and for example, in the article we have included a very, a little box that explains, how we use the term in the article, but more generally, the misinformation term can really, include very different kinds of false, inaccurate, or misleading information. And basically there is not really any standard, measures. So as researchers, we are always, of course, especially I'm speaking for myself. So being a data scientist, we work on this data and these topics and trying to measure things and to, use a quantitative approach to measure this. So of course we need definitions. The problem is that, of course, these definitions can also, vary across the different studies, across the different, disciplines, and this makes it more, challenging to derive some definitive, conclusions, because of course maybe what you're measuring in one study is not exactly what you're measuring elsewhere, or for example, because as I said, you're focusing on a particular social media platform, you're focusing on a particular country, and so on. For example, one of the biggest problems that we have in that we have and that we have been observing is that the great majority of the studies that we have on misinformation, for example, spreading, are studies conducted in the US or in the UK, so we have fewer works that are focusing on other, countries. Of course, lots of in this minority we have lots of works maybe focusing on European countries, but but we are missing, lots of information and insights on many other, on other continents and on other countries, and we cannot necessarily, apply the same insights that we got from a study in the US to other countries where the cultural characteristics and, sociocultural characteristics can be very different. So I was mentioning, so the challenges of measuring misinformation, and on the other side, the challenging of measuring behavior. Basically, of course, you can understand that it's not that easy, to measure behavior. You will need, to know, what people are actually doing, and even if you know that, understanding the effect of, so isolating the effect, for example, of information encountering on social media or misinformation encountering on social media is not trivial at all. So what we have so far in the literature is that we have some indications that misinformation can have a role in shaping, for example, some beliefs, and so factors that can be, antecedents to a behavior, but there are very few studies that are really focusing on the link between misinformation and actual behavior. And even in these cases, usually these behavioral measures, are, for example, focusing on activism, so a very specific kind of behavior. When we talk about behavior, and for example in this particular case here we are focusing on health behavior, so imagine all the different behaviors that we can have. It can be, your decision, for example, to get vaccination. It can be during, during the last pandemic. It can be, your how much you want to adhere, for example, to lockdown measures, if you wear a mask. So there can be very different and great variety of behaviors. And so we can also have, studies that are focusing on different kinds of health behavior. And this is also the other, big then challenge on putting together all the results. And this is why we do not have, definitive conclusions on what we have on this link and on this, causal relationship and causal links. Of course, as I said, there are lots of problems in linking the online activity with offline behavior. And then, of course, we have also to understand what we mean by behavior, and so how we are measuring, behavior, and in that particular case. And so the other, of course, we do not, and what we are lacking now is that we do not have, standardized definitions, standardized measures, okay, so far, so that, and this is making, more complicated to basically to prove this link that, as I said at the beginning, is instead given, for granted. Of course, this, as I said, understanding this relationship, and in general, understanding what's happening online can be very useful, not only, just, for understanding how we interact with information nowadays, what are the dynamics, how we interact, as citizens, for example, in the public discourse, but it can also be, something that can be used to, for example, improve the way in which health institutions are communicating with the public. And this is especially important when we, for example, want to counter misinformation, because if you, for example, go back to the very, first months of the pandemic, or very first weeks, of course, we were in this moment of very high uncertainty. We didn't know, many things about this virus. I'm Italian, so, and I live in the northern region here in Veneto. So here we had the very first cases. So people didn't know, what was happening, and was looking for answers. And misinformation very often, gives these answers, and very simple answers to very complex questions, and leverages, some, in particular, some emotions, like, for example, fear. So, of course, but understanding what are the needs of the population, the informative needs of the population, can also provide, for example, health institutions to understand where to direct, for example, their communication strategies, or, for example, to understand why a particular, community is so scared, or does not, is not willing to get vaccinated, despite there are, there is, the vaccines are available, are safe, and so on. So, and indeed, what's happening is that, of course, on one side, health, institutions and organizations have recognized the role of social media in the public debate, and so they've also been, starting using these platforms to communicate with the public. But on the other side, they're also understanding that the data that we can get from these platforms and the information can be used to improve the effectiveness of their communication strategies, and so in the end of the health measures. So, for example, the WHO is now offering a guide to try to use social media listening for trying to reducing the gap between the recommendations and the population behavior, and they're basically recognizing that this can facilitate the understanding of the what the information of what information the population has, or how they are looking for information, what kind of information they are lacking, and their behavior. So of course, in this sense, not only for health, of course we are focusing in this particular paper on health, but of course this is true for many other topics. We know that social media data can offer the possibility to analyze the users, I would say groups, behavior and users behavior on a very large scale, and this of course can provide information also, very in a very timely manner, when if you compare this kind of analysis and this kind of approaches to more traditional methods, like, I don't know, surveys or focus groups and so on. Of course, on the other side, the challenge is to get, the good samples. As I was saying before, we have, different social media platforms, different populations, very many differences across countries, and across also segments of the populations, using a particular platforms. And data access is now one of the biggest challenges that we have as researchers working with this data, because data access is still too limited. We do not have access to all the data that we would need to run very good, sometimes very good analysis, and access to the data is not straightforward. Many times it relies on the willing of the platforms to collaborate, and this is also something that we have been discussing a lot in the last months in Europe, to kind of improve the access to user data from social media platforms. And of course we have to deal with all the issues related, for example, to privacy, but on the other side, I always like to stress the fact that it's also important for us, as citizens, to understand what are the dynamics on these platforms that, as Cecile was remarking at the beginning of this conversation today, are, we have billions of users on social media platforms, and it's, as citizens, it would be really important to understand, what are the dynamics over there, but also what can be, the effects on us, on how we behave, and also more generally, just to be more aware, of all these dynamics, and be what we can do to be better users, for example, or just to improve our news diet, or the way in which we interact with information. And then of course, for of course, I think that it's clear that we do not have any definite answer, but what we do need for unveiling this relationship between social media and their effect on us and on our behavior is that we need more studies. We need very rigorous studies, and we also need studies that can, for example, be longitudinal studies where, for example, we can you know track people's behavior for example over time, and understand what are the effects of the different, for example, channels that they can use for information and the kind of information they engage with, so to understand what we can do to make, for example, this relationship healthier, and to more generally improve the quality of the information ecosystem, so that we can provide quality information to the population, to citizens that are well informed and can then decide in a more informed way. Yeah, I think I talked a lot, so I think that I can stop here, and I'm happy to answer questions or any comments that you may have.
Yeah, thank you so much, Fabiana. We'd like to announce to the audience that we are opening the floor for questions. Yeah, just raise your hand if you have any questions. We will bring you up the stage so that you will be able to have an engagement with our guest speaker. And before anything else, I'd like to reintroduce our guest speaker for those who just came in. So, Professor Fabiana Zollo is an associate professor of computer science at the Foscari University of Venice, Italy, where she leads the Laboratory of Data Science for Society. Since 2019, she has been serving as an expert to the European Food Safety Authority, and in 2020, she joined the working group established by the Italian Presidency of Council to study the phenomenon of disinformation and COVID-19. So, yeah. Anyway, just raise your hand if you have a question. So, Fabiana, I'd just like to ask you regarding the study on COVID-19, based on the paper that we had pinned at the top of the screen. Um, were there questions which arose after you had finished this particular study? What kind of questions did this lead to? Because you said earlier that, of course, there are no conclusive answers. This requires further study. So, did you come up with some important questions?
Okay, so of course, so as I said at the beginning, this is not, a regular research article, is an analysis piece. So the what we had in mind was just, to kind of raise, the topic, on what we still miss to fully understand, what are these links. And I think that, this is something that I think is just, important to be aware of, because of course the topic of misinformation and the possible effects of misinformation on behavior are and of course, as I said, we are focusing here on health behavior, but you can easily relate this, for example, to voting behavior of any other behavior that can be really important to understand and to track. So I think it's really important to understand what the research so far and the data that we have been analyzing and that were available so far can tell us. And of course, this does not mean that there is no harm, for example, of misinformation, and that there is no relationship. But I think it's also important, to acknowledge that there are, important challenges when we want to measure this kind of phenomena, and that our, studies have to go in that direction to try to fill the gaps that are there, nowadays. And, it's something that we can do if we have good data, if we have more data, if we have the support, for example, of social media platforms, or in this particular case, for example, of health institutions. So I would say that, from the point, is that, of course, and maybe this is, also my, position, like as a scientist, but also as a data scientist, that, it's also important to understand what the literature and the research is telling us before, because this is also important when we want to deliver some countermeasures, for example. And so it's important to understand what we know, what we don't know, and so what we still need to do to improve, our research, so that maybe we will have more answers, and maybe more, robust answers to these questions.
Yeah, thank you. So, of course, I understand that as data scientist, uh, you need data actually to be able to do your study more effectively. And I think this is a very timely presentation that you made because, aside from the public health crisis that we had in the COVID 19 infodemic, um, we are now in the election season, and especially about the US and also some parts of Europe. And well, maybe in the future you can talk about the role of social media for this because it's getting tougher and tougher. And in the past years, I know that some countries were used um, just like lab rat by social media companies. There was a big scandal before about Cambridge Analytics and Facebook.
Yes.
Yeah. So, and of course, they also learn from it. Those who try to implement these studies, they also learn from it. They keep on improving, and it's always a very dynamic and a progressive process. But now in the US, it's really hot, and I could see that during the COVID time, there's a lot of misinformation, and that's why actually this is one of the reasons why we started to have conversations with serious researchers like you in quantum photonics, because of course we would like to just present serious research and have a good conversation and minimize this problem of misinformation as much as possible. So I would just like to comment that, in my opinion, I think that this reaction or the crowd control or yeah, in the COVID infodemic would vary from country to country because basically it would be based upon the culture and connectivity. And I would say that, for instance, in Japan, wherein the people are really, looking at the situations wherein it is like, if they have a duty, some duty to the country in general, of course, not all because times have changed, but if the leader of the country will say, let us just consume 1 teaspoon of sugar every day. So in general, people will try to follow that because they feel that it's their duty. So it was not as there's misinformation, of course, but it was not as difficult as other countries, as I noticed in the US actually, and also in the Philippines. Even some physicians in the Philippines whom I know personally are also engaged in such misinformation during this pandemic. So I
Mm.
think I would like to encourage you to continue your study along these lines. So, yeah.
Uh, so I was reading some of the comments, and um, I was seeing, for example, that someone is talking about truth. And so, of course, this is, this is again the what we have to keep in mind whenever we talk about misinformation, that as I said before, it can, encompass a variety of different kinds of information. It can go from, some, clearly kind of false information that is not, does not correspond, for example, to scientific facts. But it can just be also sometimes just inaccurate or misleading information, or for example, you can also have, propaganda, or for example, conspiracy theories that are very different, a very different kind of information. But, keeping in mind this also sometimes, the challenge in defining, misinformation, I think that is also, it's also very important, not only for all the reasons, I told you before. So of course, if we as scientists, we are using different definitions, it's also, kind of difficult to put together all the results, or to link the results together. But on the other side, this is also very important when, for example, we think about possible countermeasures, and especially when we are talking about kind of removing content, so content, for example, moderation policies, or automatic detection of, for example, misinformation. And I think that of course, sometimes these kind of solutions are the kind of solutions that we think are can be kind of the most effective, or the first thing that we can do, just to stop some content to spread around. But on the other side, it's also quite difficult, as I said, because if we do not have some clear definition, you can also have some side effects on what you are removing, what you're controlling, and on the other side, I think that one important element here is who's doing that. And in sometimes, and this happens very often, we tend, for example, to ask for this kind of control or content moderation, and we tend to ask for this kind of actions, to ask platforms to do that. But this is maybe something that we also have to think about, like if we really want private companies to decide what they should keep and what they should remove from platforms that have become very central in our public lives, and I think this is a very important point, not just because we have to dismiss that kind of actions or measures, but to understand how complex this kind of so how complex the topic is, and that we cannot have just sometimes some solutions that first sight they should work, they can have side effects that we didn't that we were not expecting. And on the other side, it's also important so as I was talking at the beginning about this the fact that we tend to be and to confine our attention to echo chambers, and so to these groups. And so it's also that users sometimes that just if that kind of content is not available anymore on that platform, maybe they can just decide to move on another platform, or they will find maybe that content elsewhere. So, and this is also why I think that maybe it would be more effective to instead focus on, of course, on one side you can focus from, for example, on who's communicating, and so, for example, to improve, I don't know, the quality of information, and the quality of for example, of the news system, and so on. But on the other side, you can also work on the users, to improve their awareness and to improve their, media literacy and so to be more aware, on what's happening over there. Of course, this is not this cannot be enough. It's something like you there can be different interventions, and some of these interventions are of course at the individual level, like the ones that I was mentioning, like let's improve media literacy among the users. But on the other side, you also need some interventions at the system level. And so, for example, if you want to improve the quality of information, of course you can train the journalists, you can improve their understanding of how social media works and so on. But on the other side, we also have the big issue of the business model of, for example, news outlets on these platforms. And so we have to find also other ways where we can try to act at the system level. Then of course there is also all the regulatory part. And as I was saying, when I think it's very tricky to kind of control the content that you have over there. And you can of course you also have all the issues related to censorship, or to freedom of expression. But on the other side, it's also very important to acknowledge and remember that, for example, these platforms have a very important role in the public discourse. For example, I do believe that it's really crucial that there is some kind of cooperation between platforms and, for example, public research institutions, so that we can also access the kind of data that they have access to, and we can understand better what's happening on these platforms and what can be the effects on the public, so that we can deliver better solutions. For example, I have seen before that there was another question on the algorithms. And but we do not have that kind of access, we do not have that kind of data. This is also why it's very difficult to say what can be the effect of an algorithm on for example on the user, for example, news diet or whatever, because usually that kind of information is not available to researchers. So we have had recently some cooperation, for example, between Meta and some researchers in the US. And of course, this is something that we would like to have there, but not as just a single cooperation, something that can become more of a standard way in which we can in which researchers can work with platforms and have access to more information. Because without that information, of course sometimes you can try to find, let's say, creative ways of to understand if there is any insight, any difference that you can get from the data. But our work would be much simpler having a more straightforward access to this data.
Uh, yeah, thank you, Fabiana. So we would like to welcome Kevin and Mustafa here on stage. And yeah, with this, I'd like to give the mic to Kevin now, and after that to Mustafa. Thank you for waiting patiently.
Oh yeah, yeah. Hi. Yeah. I'm probably not the best to ask for social media, but I've seen some studies for associated with body dissatisfaction and negative self comparisons, and you know sleep quality. You know, particularly in individuals who experience stress and anxiety. I've seen some studies on this and like lower self esteem and you know particularly in individuals who experience cyberbullying, get lower self-esteem and depression. So all this negativity stuff. So studies like that, I've seen studies like that for all the apparently negative stuff. But also, I like to comment on, this Google Lens, compact lens and glasses coming out, where you have Zoom, and you'll be seeing people face to face more. But you know, otherwise, you can just you can leave comments, anonymous, not anonymously, but so you can sort of be a keyboard warrior, and with no face behind it, and you can be so you can act like that, but when you get Zoom, you get face to face, people don't quite act that way. So maybe a comment on that. Some of the things I thought of there, I guess.
So for your first comment, yes, there are some studies, as you were mentioning, on the effect of social media, for example, on mental health. As I was saying, before, okay, this is not my field of expertise, mental health, but what usually these kind of studies are. Correlative studies, so or you have very particular samples of the population. Of course there can be some effects, but again I am going back to the point that to understand if there is any causal relationship between the use of social media and the effects, for example, on mental health, you will need more data to prove that. And this can be, for example, just because maybe some particular categories of users, for example, are more inclined to use a certain social media platform, and so you start having a biased sample. You start using a biased sample, and so also your results can be affected by that bias. As I said, this that I'm stressing this because I'm not saying that there is not there is no effect at all of social media, but especially when if we as a scientist we need usually we need more solid results and insights to be sure, okay, that that's really the case, because you can have many other factors that can affect behavior, or in this particular case, for example, mental health. Then on the what you were mentioning, Google Lens, and of course here I'm just maybe I'm just giving kind of my opinion, because I haven't run any studies like that. But what I can say is that we know, and there are studies that show that the behavior of users on platforms is of course also sometimes shaped by how the platform works, and the kind of not only the functionalities that the platform offers, but also really the kind of actions that you can do, and the design of the platform can also kind of affect your choices as a user, like how you express yourself, how long your messages are, the way in which you can, you talk to people. So yes, that can be, another element that can change the way in which we interact with others on social media, on platforms in general, and the fact that on social media you are, talking to other people, and in some cases you're not even using necessarily your own identity, but maybe you can also kind of act in a more anonymous way, this of course can also change the way in which you tend to behave with other people. On the other side, I would also, I think that it's also, useful to recall that the fact that you can be, anonymous, the fact that these platforms, can offer, the possibility to someone to talk without being linked to their own, for example, identity in some context and in some countries can save their lives. So sometimes we are often, thinking about these. When we are discussing about these topics, of course we tend to do that with the lens of democracy. I mean, at least from my perspective, because I live in a democratic country, but that's not always the case, and social media platforms are also available elsewhere. So whenever we talk and we think about some of the measures against misinformation or I don't know, radicalization or extremism and so on, we also have to keep, I think, that in mind.
Yeah, thank
Oh yeah,
you.
and the I just I was just gonna say yeah yeah we need more unbiased data than the preliminary ones. Of course, yeah, I yeah, I see what you mean. But also, does the studies also for physical effects, like stress and high blood pressure, we need more data for that as well? Do you know? Sorry, Cecile.
Yes, I mean it's all linked to what I was saying before. As you not necessarily. Sometimes maybe you have small studies, but it's not necessarily a causal study that you have over there. Yes, we need more data for that too.
Yeah, Kevin, thank you. And yeah, if there's time later on, we can circle back to you if you have more questions or comments. In the meantime, I would like to thank Mustafa for patiently waiting. So I'm passing the mic to you, Mustafa.
Thank you, Cecile. Hi, everyone. First of all, I want to thank Fabiana for her very good studies and for taking the time to share it with us. It's very informative studies and raises several important issues. I have a few questions, if you don't mind. First of all, how do cultural and sociodemographic differences influence the effects of social media on health behavior? And what kind of strategies do you propose to address this variation in future research?
Thank you, Mustafa. I don't have really the answer to your question because, as I said before, I mean, at least for me, so working with social media data, demographics is not something that we usually have about users. So we know sometimes, and we have observed in some studies that there are differences of demographics across, for example, countries or across social media platforms. But since we usually do not have that kind of data, it's really, really difficult to say what can be their effect, on behavior. So I think that your question is, of course, very interesting and goes exactly in the direction of what we are, kind of recommending in the paper. And so the fact that we need more also demographic information, because that kind of information can really help us understand if so there is any of this link and effect on behavior. And so when you have that kind of information, then you can act for example towards, I don't know, particular segments of the population and so on. So at least, of course, I'm talking here about social media, so social media data. when I say that we do not have any demographics. Of course, it may be in other settings and in other, research areas where, I don't know, they conduct other kind of experiments working with people. Maybe that kind of data can be in some ways, related to behavior or behavioral, outcomes or antecedents of behavior, as I was saying before. But when we talk about specifically, when we talk about social media, usually that kind of information is not available.
Yeah. You mentioned the importance of collaboration between researchers and the social media platform. It's very essential. Do you think that we have to, or what ethical measures should be put in place to ensure transparency and user data protection?
I mean, of course, here there we need, I think that we need some regulation in this sense. It cannot be, just something kind of some sort of agreement just between, for example, researchers and the platforms. Of course, the platform's interest is to protect, their users and to protect, their users' data. So in some way, they do not really have any incentives, sometimes to share this data. And but I think that it's important, and at least here in Europe, this debate is really active, and we have. Already some regulation in place that should enable data access to researchers, but it's still not really that straightforward, and so we still need to have mechanisms that are more more clear and simpler to allow for this relationship. And of course this has to pay attention to the privacy of the users. And so of course privacy concerns are are important, and of course they have to be a part of this debate, and are kind of primary element of these regulations. But on the other side, as I said, I think that an important point is that we should find ways, of making this work, because the current situation is that this data exists and is just property of private companies. And I don't know if we want, to keep things as they are.
Yeah, thank
Yeah,
you. Mustafa, do you have
yeah,
uh, a
yeah.
comment?
Yeah. Um, Perhaps we have to think how users can have power uh, for having these informations. I have another question. Um, you you tell us that we are almost 5 billion users of social media. Do you have an idea what is the predominant influence of social media on users' health, perception, and behaviors? And how can we balance the educational and social benefits with the risk of misinformation and polarization?
Can you repeat the first part of the question, because I didn't get it?
Yes, I said you mentioned that we are 5 billion users
Mm-hmm.
on social media, and I would like to know what is the predominant influence of social media on users' health perception and behavior, and how can we balance the educational and social benefits with the risk of misinformation and polarization. And
Okay, so
perhaps a subsequent question: How can how do you think human AI collaboration could improve the fight against misinformation? On
with the AI, you said AI.
Yes,
Okay,
I think you
you
said
said AI. Okay,
human AI collaboration. That was his
yeah.
third
Okay.
question.
Um, okay, so if I'm getting the first question right, so on the, what users' perception, on, social media in general and so on. In the paper, we refer to the digital news report of 2023 by the Reuters Institute. And so if you're interested about this, I would suggest going through the this report. It's quite interesting because it's basically an overview of all perceptions and attitudes of users on on news, so how they're getting informed, but also of course there is something about social media, and so there, for example, their participation, so how they're getting news through social media or online channels, and for example the problem of misinformation. So that report is really providing, it's, I mean, at least because it provides an overview country by country in different continents. So it's, quite a complete source that you can use. And of course, it goes much beyond, the topics that we are covering here today, just focusing on social media. But for example, on the other side, the one thing that emerges strongly is that users are on social media, but they are very concerned about the quality of content that they can find on social media and the spread of misinformation. And I think that of course this can be related to what we have been discussing in the last hour today. So how information can be very easily created and can spread very easily on social media and so on. On the other side, I think that is also of course related a lot to how in the public discourse we are talking about social media and misinformation, because very often misinformation is kind of presented like a topic or a phenomenon that is just related to social media. But I do like to usually to stress the fact that social media is just a communication channel, and of course it has all the characteristics and special characteristics that we have been talking about so far. But on the other side, misinformation is also something that can belong to other channels, for example more traditional channels like, I don't know, the TV or the print. But for those channels, we do not have it. Usually, we do not have. We have less data, and this is also why we are focusing a lot on analyzing this kind of phenomena. For example, using online data and social media data. But okay, so this was just to add a bit more to what you were to what you were asking. For the AI, and so this collaboration, human AI, I think that of course, as all new technologies, of course, AI can provide some important, benefits. And it can also become a way in which we can, for example, I don't know, improve the quality of content now what we of course that but there are many, there can also be um, many side effects of this. Then, of course, when we're talking about AI, we can talk. So AI is again a very big umbrella, but with, for example, the wide availability now of these language generative models, we have, seen how easy it can be to, to produce text or to produce, for example, fake images or fake videos. And so this is, of course, something again that can make even more challenging, to interact, not to interact, but to trust content on social media platforms. And this is for sure something that we will have to deal with. I'm not sure that I don't think that I have a definitive answer to this question today. I do believe that as a tool we can find good ways of using AI to improve the way in which we can use these platforms as users, or for example in the way in which these platforms can work. But on the other side, I still do believe that of course the users, someone said before, so the users have no power. Well, of course, the users are kind of so apparently they do not have any power, but on the other side, we are the users and we decide where we want, to focus our attention, where we want to stay, how we want to use these platforms. And so I do believe that one of the very important things that we can do is that we work on the education and awareness of the users, because users are making the platforms, we are calling these platforms social platforms for a reason. And I do believe that we can also find a way in which we can improve the way we behave as users on the platforms.
Thank you
Yes.
very much. Thank you very much, and
Thank you, Mustafa.
because it's your studies is very hard and difficult. You choose the field of health, and I don't know if we can scientifically uh, qualify what is information and misinformation in this field. So you are very correct, very hard study case. Thank you very much.
Yeah, thank you, Mustafa. So we have Isha on stage, but I think I'd like to read a comment here, which was written a while ago by Karen. And yeah, I'd just like to give her a chance to be heard. So she was making a comment. What about the research data in regards to the COVID pandemic from the CDC or the NIH? Are you comfortable with the research and information? I am asking this question with all sincerity and respect. Yeah, so these are U.S. institutions. So, yeah, I think she's asking about your comment on this.
Yes, I'm not sure if I get the question right, in the sense that, of course, we can have data on, for example, CDC data, or so this kind of data on vaccinations, for example. But what I was telling is that it's difficult to link that kind of data to the same users on the social media platform. That's the kind of data that we are usually missing. So maybe you have lots of data on what you can observe on the platform. You can also have the data on what people did, for example. So the data about vaccinations, okay, but it's not that, straightforward to connect the points, and so to put together these two kinds of data, because the samples can be very different, and you cannot, just, so there are, for example, there have been some studies where you can find some correlation, for example, between getting vaccinated and using social media, but these are just, correlative studies. There is no causal link that was approved over there, and it's also because sometimes you have the data, so you have aggregated data, for example, I don't know, at the country level or at the county level or whatever, but you do not necessarily have the corresponding data on social media.
Yeah, thank you, Fabiana. So I think there are other questions and comments on the room chat. We'll try to read them later if there's time. And in the meantime, there's Aisha who came on stage. Aisha.
Hi, good morning, Cecile, Fabiana, Bob, Kevin. Good to see you guys. Thank you for this. This is amazing. I wasn't even expecting to be on Clubhouse today, and I saw the ping, and I said I have to be here because this is a timely topic. My question for you is, what are, now you might have addressed it in the study, I couldn't find it, but what are the key sociodemographic factors that might make certain populations more vulnerable to misinformation?
Yes, so maybe you missed this part before, but thank you very much. First of all, thank you very much for your comments. And as I said, so I do not have the answer, but I mean, based on what I usually do, because working with social media data, we do not have, information about the demographics of the users. And so it's I cannot answer now because I don't know. That's not some kind of information that I can get from my data. So to understand what are the populations that are more susceptible to misinformation, but what I can say is that of course there are other studies where so maybe not using social media data but running other kinds of experiments, there maybe they found some relationships between some demographics and misinformation. But what I can say is related to what I was mentioning at the beginning, and so the fact that so the way in which we tend to interact with information when we are on social media platforms. And I was saying that we tend to select and look for information that is aligned with our worldview. And this is generally true, but this is generally true, but this is also true when we talk about misinformation. So we are much more inclined to accept misinformation as reliable information when that kind of information is aligned to our beliefs, to what we already think, and so on. And this is a very important mechanism that is something that does not encompass a kind of just single, for example, part of the population and so on. So what I'm saying here, and so my known kind of known answer, but what I'm saying here is that it also depends on the misinformation that we are considering, because for example, misinformation about vaccines can be something that can be for example, something that can attract some specific subpopulations, but that's not necessarily true for another subset of misinformation. And this is also why I was stressing the fact that, of course, not having is the definition of misinformation, and having studies that are focusing on very different kinds of misinformation can make our work as researchers, like putting together all the results more difficult, exactly for that reason.
Thank you. I definitely feel you on that. That does sound like a challenge that you're facing, but it is really timely that you, again, I say that word timely, it must be the word of the day. But, just it's really personal to me, and it should be because it's data and it's facts. So I think the question that I want to follow that up with, what long-term strategies would you recommend for improving public, uh, let's say resilience, a new word of the day, against misinformation? Um, how can people
Wow.
like what should we
Okay.
foster in ourselves, like in for future campaigns?
Yeah, this is a tough question, because it's not that easy. I think that as I was saying before, you have to work on very different on different levels. It's not something that you can just tackle by, I don't know, like, okay, we will apply content moderation policies. I think that you have to work at different levels. So you have to work on you know of course, on the kind of information that is accessible to the population. And so if you focus on that direction, you can focus on finding a business model that is sustainable for for example, for news outlets, for high quality news outlets to be there and to provide that kind of information. And of course, there can be trainings, for example, for communicators, for journalists. You can also act from at the you should also act from the regulation perspective, and so find ways in which you can foster transparency and you can foster cooperation from the platforms with with the society. You can invest on research, and so ensure that there is enough data and enough, for example, funds to run this kind of research that has to be independent research, but has to be is crucial to kind of also in some ways monitoring what's happening, and so what's happening on the platforms and what are the effects. And then of course you should also, at the same time, you also have your users, and users I think have to increase their awareness on what how they work, how we work as human beings whenever we process information, how we behave whenever we are immersed, for example, in social media platforms, how we can tend, for example, to avoid increasing being immersed, for example, in a very polarized environment, or for example, increasing polarization around us. But in the end, I do believe that it's also a matter of that's why I was using the term awareness, because I think that the users need to have all the tools, all the instruments, then to act, in an informed way. Because maybe, here, maybe today, in this chat, maybe there is someone who wants to be in their, echo chamber because it's comfortable, and because you do not want to, because maybe social media is the part of your day where you can escape and you just want to interact with people that you like, and you do not, want to see something that you don't like, and that's completely fine. I don't think that we have necessarily, to find ways to control, the way, but I think that it's important that at least the users, so people, are aware, of all these mechanism and phenomena, and so they can also, be more proactive, in the way they're using the tools, and so this can also become a way in which they can maybe defend in some ways from misinformation. So there have been some studies run from colleagues, especially, for example, in Cambridge, where they're working on interventions on misinformation, where basically they are applying these pre-bunking techniques, which is a kind of the idea of, providing people with some antibodies, to be able to better process and to be able to recognize, for example, misinformation at a later stage when they encounter it. And the results are promising. Of course, for example, the results are really limited, so you can observe, some maybe effect in the very short term, that there's still, there is still we still need more research to understand, how long this effect can be. But there are also some ways in which we can help, the users in improving the way in which they, interact. But we need, for this, you need education, and you need trainings. And so, yes, we have to work on very different aspects. I don't think that I have a magical recipe today to give it to you.
I just want to respond. Thank you so much for that answer, because what I appreciated most about it was that it's not to increase further polarization. For conversations to be had, people need to feel respected and safe enough to say what they want to say. So that's what I got from your answer as well. And then the second thing is, how do you measure if someone is um, if they're misinformation? Like if they believe something, that's fine. They can believe what they want, but how do you measure whether or not they have lower levels of being susceptible to misinformation after a training? So, I mean, that's not
How do you
necessarily another
measure how
question,
much
but
they are
yeah,
susceptible?
right.
Okay.
Like
I mean,
after they've maybe gotten some
yeah.
training, like what kind of methodologies might be employed for that?
Yeah, but this is more a question for a psychologist. So I'm not sure that I can give you really honestly the right question, because it's not exactly what I do. But I think that for sure there are maybe some elements that can increase the susceptibility to misinformation. Like it can be, for example, sometimes it's very, there are studies that have shown that there is some correlation between some, ideological beliefs and some kind of misinformation, or some so I think that, of course, you can so whenever you can identify these kind of aspects and these kind of elements, and this can help, in maybe adjusting the communication strategy and the way in which you are, delivering information to the public. Because, as I was saying at the beginning, this is also a way, and in this case, social media can really provide very good, very good information, because it's also a way, if you identify the needs, what for example, that part of the population needs in terms of, information. Sometimes that can be really the key, because lots of misinformation is believed because it's basically addressing that need. not in the way maybe we would like to, but it's basically addressing that need that sometimes, it's the need of being listened, or some fears that have to be in some ways, addressed. So yes, I think that there is, of course, with more studies, more research, we can put together all these insights and also improve then the way in which we are reacting. That can be very simply just the way in which, what kind of information you're providing, and in what terms you're providing this information.
Yeah, thank you, Fabiana. So we have Joella and Kyle on stage, and we've been here for about 1 hour and 36 minutes. At this point, I'd like to ask Fabiana, how much more time does she have for us? So, yeah.
Yeah, I would actually have to go in 10 minutes. So maybe if we are able to, close these final questions in the next few minutes, that would be fine with me.
Yeah, thank you so much. So we have two remaining speakers here on stage. I think that's enough. And yeah, I'd like to give the mic to Joella in for now. Yeah.
Oh, yeah, thank you. Yeah, I came up because I wasn't certain about how much time the questions in the chat will be answered. So thank you, Cecile and Fabiana. You may or may not have answered this already, but I was curious about what your thoughts on the newfound emergence or reemergence of AI and social media. I mean, AI has been around for a while, but now, it's kind of becoming more mainstream, and possibly contributing to any misinformation, if any, and if so, is the misinformation, or do you see high rates of it or low rates of it? And especially what Asia stated, is very timely given the fact that the U.S. and other countries are going through an election process, and we have seen AI kind of play a role. Um, during times of election, with deep fakes and taking someone's voice that's not really there. So I just wanted your, um, opinion on that. Thank you.
Yes, thank you very much. Well, you know, the short answer is that, of course, this is just making things much more complicated than, and they were already quite, complicated. So, of course, this is not helping, because, especially when, deep fakes and mm, this kind of misinformation, even for skilled users, like maybe lots of people here with us today. Even this is making things more challenging even for skilled users. So I do. So of course I do think that this is something that for sure can complicate things. On the other side, I don't think that we can really kind of stop, of course, AI, and of course, regulations are something that we need, but also in that direction we have to be, I think. So we really need to have very good synergy between experts and policymakers and regulators, so that we are able to tackle this problem effectively, because as a scientist, what we sometimes observe is that especially from the a regulatory point of view, decisions are sometimes not really made together with the experts, and so this can create some either that don't solve doesn't solve the problem, or in other cases it can create new problems or make things worse. So I do believe that since it's a very complex issue, and it's not we do not necessarily have a very simple answer to that. I do believe that we need to a collaboration across not only, different parts of the society, but also across different disciplines. But we need, but of course, it's something that we need to do. And you know that in Europe, for example, we have the AI Act, and the AI Act is also, in some sense, so it's also working, for example, to limit and reduce, the spread of, for example, misinformation, like, by introducing more, some regulations, or indications, for example, so that the users have more information on the kind of content that they are encountering. And again, here again, we need the support and the cooperation of the social media platforms. But yes, of course, this is not happening. And of course, as I was saying, so far, of course, we can work, and we especially, with the, possible threats, posed by AI. I think it's even more crucial, to work on the education of the users, but that's of course not enough. We need also to operate on other levels.
Thank you. Thank you for your response. Much appreciated.
Yeah, thank you so much. So we don't have a lot of time, and Kyle is here on stage. And I would just like to mention, Fabiana, every day I try to read AI papers, and yeah, I think in relation to like education, what I can say is that there's so much still to learn about the use, for example, of LLMs in education, its advantages and disadvantages. Because recently there has been a study by Princeton, and they were saying that, for example, in a math Olympiad, LLM could be effective in certain ages or certain questions only, but to help us in education. But in some cases, on certain ages of um, or levels, it's not still very helpful. So I think, studies like this are very um, advisory to those who are making new policies, because of course the world is changing, and the educators should think about that. And at the same time, I read some studies about using all LLMs also to counteract fake news, and also having this fake personas and fake videos. So yeah, there's a lot, I think, to study still, and also algorithm manipulation as well. So yeah, I would just like to mention this. I'm sorry I used up some time, but I'd like to give the mic to Kyle now, who will be asking the last question.
Yeah, amazing presentation. Thank you so very much. Really enjoyed listening to you and hearing your thoughts about your research. I was just wondering, in Italy, I understand that they teach philosophy in high school, whereas in America they do not. Do you have any comments on that as it relates to counteracting a person's ability to recognize misinformation and disinformation?
Um, okay. Yeah. I studied philosophy in the high school, and was, quite some years ago now. Um, well, I think so. I'm getting, I think, where you're going, and I think that in general, what I can say is that, of course, I'm not an expert, in philosophy, but I think that it's very important, to remember that, this definition and this kind of mm, um, we always tend to think about misinformation like something that can be either false or true, right? And as even if, this seems like quite easy and straightforward. In the end, that's not always the case, and these definitions are very tricky. And this is exactly this is exactly why I was mentioning at the beginning, also the fact that whenever we are studying misinformation, of course, you need some kind of definition, especially if you are using, if you're using data. So you need some kind of definition, and these definitions can vary a lot. But of course, you're just, so I think that one thing is that you need, you can use a definition to study and analyze a phenomenon. But for example, if you think about using the same definition for example, removing content, whenever we can have imagine that we have an automatic an automatic detector for misinformation. First of all, of course, you need to define what misinformation is for you. And on the other side, of course, we can also, and so I already said that's very tricky, but on the other side, we also know that the automatic detection, for example, through an algorithm, can also be wrong. And you can have different ways in which the algorithm can be wrong. It can be because you have false positive or you have a false negative. But if you're using that kind, for example, of detection algorithm, okay, to remove content from a social media platform, for example, of course, you can have some effects that were not maybe necessarily considered at the beginning, like you are removing legit content. But this is just to say that I think that it's so I'm stressing this again, but it's much more complicated than just reducing the problem to false and true information. And this is why I tend to avoid using, for example, the word true or the word also false in our papers. And I think that this was also, the problem that maybe we had. One of the things that we could notice, especially at the beginning of the pandemic. I was mentioning before, this idea of, so the fact that we had lots of uncertainty. But if you have always presented, kind of information and also misinformation, like a problem of being false or being true. When you are in a situation of uncertainty, sometimes you do not necessarily have the answer for a particular question. And so, but people are expecting, for example, you to give the truth. In Italy we had this, so this is just an anecdote, but we had a politician at a certain point of the pandemic that basically asked science for true and certain, information, but that's not how science works. And I think that, and if you think about that, for example, using a very, common definition like what's true information is information that, is aligned with scientific facts. So if I use this kind of definition today, the lots of information that we thought to be true at the beginning of the pandemic would be classified as misinformation today, because those facts evolved and changed, and our knowledge, scientific knowledge, for example, about the coronavirus changed and evolved. So I'm not sure that, Kyle, I answered to your question, but I think that I like to remark that even when of course there is some kind of information that for us is completely false, because there is clear evidence or facts that can support our claims, but on the other side, I do believe that we have to acknowledge that generally speaking, things are much more complicated and there are many shades, and reducing the discussion of the problem to a discussion of the truth, so true versus false, I don't think that can help in tackling this phenomenon effectively.
Yeah. Thank you, Fabiana. So I think we have to wrap up. It has been a great time listening to you and also interacting with you. And we hope that we can invite you back here in Quantum Photonics in the near future. So yeah, if you have comments, please speak.
Thank you very much, Cecile, for inviting me, and thank you everyone for listening and for your questions and comments. It was very nice to be here with you today.
Yeah, thanks again. I'm very glad that you enjoyed your first Clubhouse experience. So we're going to wrap up, and I don't know if Bob has something to say, and then after that we will pass the mic to Darcel to help us close the room. And thank you, Kevin, Isha, Juela, and Kyle, and of course Mustafa. So Bob, mic to you.
On behalf of everyone in the audience, I wanted to say thank you for a very timely and in-depth discussion, and I walk away with things to think about. I thank you very much.
Yeah, all right. So, yeah, thanks, Bob. And let's give the mic to Darcel now to help us close the room.
Thank you, Cecile, and thank you, Doctor, for a great talk. To close the room, we're going to start our countdown from lucky number 8. Is everybody ready?
Ready?
Ready.
Yes.
8.
Eight,
Eight.
8.
Kyle, 7.
seven,
Joella, 6.
6.
Asia, 5.
Five.
Kevin, 4.
4. I'm getting a red bar. Hello.
Bob, 3.
3 it is.
Cecile, dos Equis.
dos X.
Good doctor, your numero uno. Call out our last number, please.
Uno.
Thank you so much, Fabiana. And thank you, everyone. I'll see you in the next rooms.
Bye, bye everyone.